increase their life as much as they can.
Ram, Ram, Ram.
Their life as much as they can. So you will realize the real value of life there. I have seen them very closely. I have seen them very closely. That's why I'm saying all this thing to you. So it should be banned. Anyways, let's come on the topic again. Anyways, so enforce ban on the tobacco advertisement, promotion, and sponsorship. No one can sponsor that, Hannah, and raises the tax. It should be very high taxable. Hannah, WHO recommends 75% of the cigarette pack price should be the tax. Tax should be very high, 75%, up to 75% of the original price should be taxed, so that it become very costly, है ना? Because ये tax के चक्कर में banning is not possible. No, government is getting a very big tax from all these products. That's why government is not banning it. And everything is interconnected. You cannot just delink everything. Everything is connected with each other. Everything ultimately ends in the political connections, and ultimately, who is suffering? The patients are suffering. Okay. Anyways, can we go ahead? Hmm? Can we go ahead? Are you there? Can we go ahead? Are you people live? Kindly someone respond. So learn the strategy for tobacco control. M power. You should know the full form of that. Hana. First monitor. M for monitor. P for protect people. The O for offer, help for quit. W for warn. E for enforce ban. And R for raise tax. Okay, can we go ahead? Can we go ahead? The superstars and role models of the country, of any place, the role models, they should not advertise any such product. They should not. It is a very big hit on the society. For them, it's just an advertisement for which they are getting a amount, a fixed amount, maybe some lakhs, maybe some crores, maybe. But it is hitting very badly on the society, very badly. They are creating many patients of the future by doing so, because they are the role model. They have followers, lakhs of followers, crores of followers following them. Whatever they do on the social screen, like the social media, their fans are going to follow it. They should always keep this in mind. So I'm totally against that, Anna. I've seen that. I've worked in Tata Memorial Hospital nearly for 6 years, and it's a, you may be knowing, it's a oncology specialist unit, Hannah. Not only in India, the complete Asia, it is the biggest hospital, the referral oncology center. Hundreds or millions of cancer patients come there daily, and we have seen the cancer patients very closely. It's very demotivating seeing a metastatic cancer patient. It's very demotivating. It's very demotivating. And when we ask them why they have started, they know that alcohol is injurious, they know smoking should not be done, so the only answer, they are addicted to that. So why they started? They got influenced somewhere, and because of the friends or because of someone, they started, and after that, addiction is there, and after that, cancer is there, after that, death is there, after that, the complete family vanishes. So it should not be done. Anyways, let's go ahead. Okay, the next is the hypertension. What is hypertension? Raise in BP. We know the normal blood pressure is 120 by 80. Here the rule of halves is there. This year FMG question, rule of halves. What is rule of halves? So there is rule of half. Rule of half for hypertension. You can see this is the whole community. From the whole community, these are the people who are hypertensive. These are the people who are hypertensive, है ना? लेकिन जितने लोगों को hypertension होता है, actually half of them are diagnosed. The remaining half even don't know that they have hypertension. So that is the first thing. From the one who are diagnosed, only half of them get the treatment. And remaining half, they know they have hypertension, but they don't take any treatment because they think that treatment is not required. It is not giving any trouble to them. From the one who are treated, half of them are adequately treated. The remaining half are not adequately treated. So this is rule of half. From the total who have hypertension, half of them are diagnosed. The one who are diagnosed, half of them are treated. The one who are treated, half of them are adequately treated. Say yes, this is rule of half. Good, you can get it. This is rule of half. Say something. So half are diagnosed. Among the diagnosed, half are treated. Among the treated, half are adequately treated. And among the adequately treated, half of them are adequately controlled. That's it. Hannah. So this is rule of half. So please learn rule of half holds good for hypertension, and learn this diagram. It was an image-based question this year. This image will be given to you, and they will ask you the disease. They can ask you the name. The name is rule of half, and the name of the disease is hypertension. I hope you got it. Can we go ahead? Okay. Okay, so this is hypertension. This is the new classification of hypertension. You will learn it better in the medicine, I guess. है ना? You know, normal blood pressure, SBP and DBP, systolic blood pressure and diastolic blood pressure. You can see. है ना? This is less than 120. This is less than 80. This is normal. है ना? This is normal. And 120 to 130, है ना? And still less than 80. It is pre-hypertension. 130 to 140 and 80 to 90, it's also pre-hypertension. है ना? 140 to 160 and it's 90 to 100, stage 1 hypertension. 160 onwards and 100 onwards, stage 2 hypertension. So this is the classification of hypertension. है ना? So this is the classification of hypertension, you can see. For preventing hypertension, lifestyle modifications are required. First, reduce the weight. Reduce your weight. The weight should be adequate. It should not be underweight, but adequate. It should be within normal BMI. The person who are overweight, they have high chances of hypertension. है ना? Adopt a DASH diet plan. DASH diet plan is Mediterranean. It is full of fruits, vegetables, low fat, है ना? Low reduced fat, saturated fat, total fat. Such a diet. है ना? So this diet is known as DASH diet plan. And dietary sodium reduction. Eat less salt. Sodium is present in NaCl. Salt should not be consumed too much. A little bit for the taste. That's it. Physical activity. Increase that. And moderate consumption of alcohol. Less than 2 drinks per day. It prevents hypertension. So it is not the thing you start drinking from today. And less than 2 drinks per day, a limited alcohol can prevent the hypertension in future. So that is the thing. So coming on the next, diabetes, you can leave. Okay. You know the cutoff of diabetes, no? You may have read this in medicine and pathology at multiple places. Diabetes ka cutoff kya hai? We take 2 sugars. What are the sugars we take? We take the fasting sugar and we take the 2-hour sugar. Fasting sugar and 2-hour. 2-hour postprandial. What is fasting? The person have not eaten anything since the last 8 hours. It is known as fasting sugar. Fasting sugar more than 126 is diagnostic. And 2-hour after eating, है ना? After eating, 2 hours after eating, है ना? It should, if it is more than 200 milligram per deciliter, it is known as postprandial. So these are the cutoff for the diabetes. I guess everyone knows that. Rheumatic fever, I'm skipping here. I guess you know rheumatic fever. Do you know rheumatic fever? It is also this thing, non-communicable disease. Do you know what is rheumatic fever? It is a disease of children. It occurs in 5 to 15 years. You see, this is a child. Can you see this is diagram of a child? Now this child is having infection, the tonsillitis. Can you see the child is having tonsillitis by a bacteria? The name of the bacteria is group A Streptococcus bacteria. Group A Streptococcus, gas bacteria. It is the most common bacteria which causes tonsillitis. है ना? So you will say, ma'am, it's very common. I also have tonsillitis multiple times in my life. You also have tonsillitis. It's very common. So what is the new in that? है ना? The body is forming antibodies against the bacteria, and the antibodies are binding with the antigen. Antigen-antibody complexes are formed. The bacteria is killed. You will say, ma'am, then how rheumatic fever is occurring? Listen, rheumatic fever do not cause by bacteria. It is not caused by bacteria. On the surface of this bacteria, the gas bacteria, there is AM protein. There is an antigen known as AM protein. On the surface of gas bacteria, there is a protein known as AM protein. It's an antigen. The similar AM protein is present in human 5 organ. The similar AM protein. Which 5 organ? The heart, the brain. You can see the 2 vital. Heart, brain, skin. Just below the skin, it's subcutaneous tissue. And below that, we have joints. Hana? So heart, brain, skin, subcutaneous tissue, and joints. These are the 5 organs in which AM protein is present. So autoantibodies are actually formed against the bacteria, but they cross-react at the 5 organ. The antibodies are formed for the bacteria, but antibody will get confused. They think it is also a bacteria and they will cross-react. You can see. So the 5 organ have 5 diseases. The 5 organ have 5 diseases. In the heart, there is rheumatic heart disease. In the brain, there is Sandham's chorea. In the skin, there is erythema marginatum. In the subcutaneous tissue, there is subcutaneous nodules. And in the joints, there is arthritis. The 5 diseases together known as rheumatic fever. Rheumatic fever is not one disease. Mind it. Rheumatic fever is not one disease. It's a cluster of 5 diseases. You can see the 5 organ having 5 diseases. It's a multi-organ involvement, multi-system involvement. Rheumatic fever is caused by bacteria? No. Bacteria is not coming and causing the damage. It is the antibody which is coming and causing the damage. So can I say rheumatic fever is an autoimmune disorder? Yes, it's an autoimmune disorder. How many of you got it? How many of you got it? Hannah? So you will see the detail of all these in other subjects. Like rheumatic fever is a very important topic in medicine as well as in pathology. You will see the details there. Can we go ahead? The next is the cancers. Tell me the most common cancer in the world, in India and in the world, in the male and the female. So let's talk about world. What's the most common cancer in the world in the males and in the females? In the males, if you say, my answer is lung cancer. And in the females, if you say, my answer is breast cancer. In the males, the second common is prostate, and in the females, the second common is colorectal. This is, I'm talking about the world. This is, I'm talking about the world. What about India? What about India? In India, the most common cancer in males is not lung, it's oral cavity, because you know the reason. Hana, our government is not banning the tobacco. Hana, they keep on chewing. Hana, they just could put the gutka there in one corner, keep it for the whole day. Hana, so that reason become mutagenic and cancers occur. Hana, so that is the thing. So this is the reason. And in females, it's breast only, like the whole world. Initially it was cervix, but now it's breast only. So in females, it's same as that of world, like breast, but the second most common in the world is colorectum. Here, most common is breast, but the second most common is the cervix, not the breast. Why cervix? Because of early marriage and early sexual intercourse in India. In India, early marriage of the females, early marriage of the girl is very common. So if sexual intercourse occurs before 18 years of age, chances of cervix cancer are more. So here you can see this is a sequence. Got it? Got it? So you should know the most common in male and female in the world, the most common in male and female, and second most common also. Here second most common is lung, you can see. So that is how you have to learn for India as well as for the world. What is the most common cause of cancer related mortality? Cancer related death का most common cause क्या है? Male female में अलग अलग नहीं है. It's lung only. It's lung only. Okay. So what I taught you, tell me regarding the cancers. Tell me regarding the world. Tell me regarding the India. And tell me regarding the mortality overall. Mortality. Who will tell me? In the world, you tell me the male and female. In India, you tell me the male and female. And in mortality wise, you tell me. Huh? You tell me two. First, second, and mortality may tell me the most common. So in world, most common is lung. Second most common is prostate. In India, most common is oral cavity. Male are chewers. They keep on chewing what? The tobacco. So that is the oral cancer. And second most common is lung. Second most common is lung. In the females, the most common is breast. In the world, it's breast. And second most common is colorectal. In India, most common is the breast only. But second most common is cervix because of early marriages. Mortality wise, most common is lung. So please understand the question very properly in your exam, what they are asking. They are asking world, they are asking India, they are asking male, they are asking female. What they are asking? Look for the options. Or they are asking for the mortality. And apart from that, the cancer details you will see in pathology, of course. And in pathology, you will see the corresponding cancers and all. So here, incidence prevalence is important. The last is blindness. I guess blindness you will study more in detail in ophthalmology. I guess you have a blindness chapter in ophthalm. You have to study in much detail. But here I will tell you, in the world, in the India, the definition of blindness is same. When the visual acuity Hello everyone, good morning. Good morning everyone. Have you people joined? Good morning Aditi. Good morning everyone. Does everyone join? Can we start? We will wait a while. Students are still joining. We will wait for a few seconds and start the class ahead. Okay? Good morning Shreya. Good morning everyone. Good morning. So today, the last day of community medicine, we are going to pack everything in a beautiful manner. At the end of the session, you will be confident. Rather, I must say, you will be super confident in the entire PSM. And you will be able to crack any question based on that. The sessions will be a little bit longer, little bit more, comprehensive, but it's worth, believe me. So, okay, students are still joining. We will wait for 10-15 seconds, okay? After that, we are going to join. So today, the plan is that today I am going to start with biostatistics. So in 1.5 hours, we are going to pack it. Okay, biostats. After that, we are going to take communicable and non-communicable. Okay, communicable and non-communicable disease. Okay, so these are the two big chunks left today. So biostats, communicable, non-communicable. And after that, we are going to national health programs after lunch. I mean to say, before lunch, if we can pack this, and after lunch, if we can take national health programs till evening. है ना? And one more small chapter was left is health communities. है ना? Healthcare, like healthcare services. So primary, secondary, tertiary healthcare. It's a very small chapter. If I could have taken it yesterday only with the small chapters. So three big chapters, basically biostats, communicable, non-communicable, and national health program. Okay. Okay. So today I have sent you the PPT of the biostats. Today maybe you have got the notes of the biostats. Please open that notes if you wish. So I'm teaching from that. Whatever I have sent you today. Can we start with biostats? You can follow any source, Yogesh. So if you have any book which contain the previous year questions of at least last 5 years of FMG, you should go with that source. Whether it's a book, it's an app, it's up to you. Whatever source. But I want you to solve the PYQs of last 5 years of FMG, of entire PSM. I want you that. Okay. So any source you can follow, all sources are good. So can we go ahead? Can we go ahead? If you wish, at the end, I will send you a few questions to practice. But it will take a day or two. Hai? So not today, but tomorrow or day after tomorrow, I will send you a few questions for practice, maybe 500 or 1,000 questions. Okay, practice questions I will send you. It will be mixture of entire PSM. So once you have listened to my sessions, after that, try solving that PDF. Hai? Questions from that. Or you may be having the questions on the app and everywhere. No? So can we start? Give me a thumbs up. Can we go ahead? Okay, so let's start the biostatistics. Please, everyone, concentrate here. What is biostatistics? Let's start biostatistics. Biostatistics is it is a term used as a tool of statistics. It is statistics which is applied to the data related to the biological science. Biostatistics. Okay, so there are two type of data. The qualitative data, the quantitative data. I will explain you both. Okay, for example, what is my hemoglobin? I will say some number. Anna, what is my height? I will say some number. What is my weight? I will say some number. Anna, my weight is 60 kg. My height is 155 centimeter. My hemoglobin is 12 grams per deciliter. So that is all quantitative data. I am saying a quantity. But what is my color? What is my color of my skin? Am I dark? Am I wheaty? Am I fair? So it's not a number. I'm saying some word. Hai na? How I am teaching. You will say, ma'am, excellent, very good, good, not good, poor. So you will say some word. It's not a number. Hai na? It's not a number. If I say, what is my religion? Hindu, Muslim, Christian, Isai, what is my religion? So I will say some word, not a number. So this is all qualitative data. I hope you got it. I have given fair enough examples. See, so there are two type of data, qualitative, quantitative. Qualitative is known as categorical data. We are saying some category. And quantitative is numerical data. We say some number. So you get simple questions on that. Categorical means qualitative. We will say the category, not the number. And numerical data, we will say some number. It's quantitative data. Okay. So the first is the categorical data. I told you categorical is the qualitative. They don't have numerical value. Okay. For example, the race. I told you Hindu, Muslim, Sikh, Isai, whatever. I told you the gender. The gender is the male or female. It's not a number. The blood group, A, B, O. It's not a number. Hai na? Presence or absence of diabetes. I'm asking, do you have diabetes? Say yes or no. It's not a number. Hai na? What is the, do you have low birth weight? Some child is having low birth weight, yes or no. Obesity, yes or no. Type of anemia, iron deficiency anemia, Miguel. So that is all qualitative data. I hope you got it. You can see. Hai na? So this is all I taught you is the qualitative. That cannot be measured directly. They don't have numerical value. Hai na? ABO blood group, gender, sites of lymphadenopathy. Is it cervical, inguinal, presence of diabetes? What is the weather today? Is it sunny? Is it winter? Is it rainy? Obesity, yes or no. Type of anemia. I hope you got it. So it is also known as categorical data. The second is the numerical. Numerical is quantitative. They have numbers. Example, my weight, my height, my mid-arm circumference, my blood sugar, my temperature, my BMI, my hemoglobin, my cholesterol. I will say some numbers. So I hope you got it. They have a numerical value and they can be measured directly. So this is the two type of the data. Okay. I will tell you three classifications of data. The first classification is qualitative, quantitative, the easiest one, also known as categorical and numerical. Okay. The second type of classification is discrete and continuous. What do you mean by discrete data? They don't have decimals. Discrete data. Say the example of the discrete data is ABO blood group. So whether the person have blood group A, whether the person have blood group B, they don't have half A, half B like that. So there is no something between that. है ना, gender, whether the person is male or whether the person is female, है ना, whether the person has cervical inguinal lymphadenopathy or inguinal lymphadenopathy, whether diabetes is present or absent. It is not कि both हो सकता है together, है ना. Parity, how many times the female got pregnant, whether she can be 1, she can be 2, she can be 3, it cannot be 2.5, है ना. Obesity, say yes or no. Number of children in the family, whether it will be 1 child, whether 2, whether you cannot say I'm having 1.5 child, you cannot say that, है ना. So they don't have in between value, that is discrete. They are discrete, they don't have in between value, है ना. And in continuous, the in between values are possible. Here in between values are not possible, whether this or this, बीच का कुछ नहीं है. लेकिन here in between values are possible. What is my weight? I can say 60 also, I can say 61 also, but I'm having 9 more option. 60.1, 60.2, 60.3, 4, 5, 6, 7, 8, 9, and then 61. So I'm having multiple in between values. Got my point? Same with height, mid-arm circumference. Say yes, say no, say something. So this is the discrete and the continuous data. So first classification I taught you, qualitative and quantitative data. The qualitative also known as categorical and the quantitative also known as numerical. People react. Got it? The second classification I taught you, discrete and continuous. Discrete don't have in between value. They are either this or the next or the next. They don't have beech mein kuch nahi hai. And continuous have in between values, है ना. It is not कि all categorical is discrete, all quantitative, numerical is continuous. It's not that. For example, number of children in a family. How many child are present in your family? You will say, ma'am, 1, 2, 3, 4, whatever. So it's a quantitative data, but there is no in between value. So, but it's discrete. है ना? So don't mix the two classification. Both the classifications are different. I hope you got it. है ना? So continuous can have any numerical value and they have the in between values also. The third and the last data is binary. Binary is known as dichotomous data, and multiple data is possible than polytomous. So dichotomous and polytomous. What do you mean by that? Here only 2 values are possible. Here more than 2 values are possible. For example, RH blood group. You will say, ma'am, I am RH positive or